Welcome back to the show. Today is Medical Monday, and today we are talking about aneurysms and the treatments available for them. We say hello and welcome to the show, Dr. Christian Bowers, Hurley Neurological Center Neurosurgeon. Good to see you, my friend.
Thanks for having me. Good to be here.
Yes, in basic terms, first off, explain to the audience at home, what is an aneurysm?
Well, blood vessels that are in the brain, cerebral aneurysms, they're circular. You can think of it almost as plumbing or piping. And when you get an aneurysm, it's a weakening in the wall of that vessel. So it forms a ballooning. And as you can imagine, over time, that never really, it doesn't get better. It just gets worse and gets larger. And there's a period of time where it could be stable. But our job is to diagnose these and find them and then give advice and management of them, because what we're trying to avoid is an aneurysmal subarachnoid hemorrhage, or when that ballooning gets worse and worse and then ruptures. And a lot of people, as you can imagine, we discover these when the rupture event occurs.
Sure.
And that's a significant event. It's a type of stroke, not an ischemic stroke like we think of, where there's a lack of blood flow, but it's an hemorrhage. And what happens in that situation is you get about 40% of the people with an aneurysmal subarachnoid hemorrhage will die. And about 2/3 will have major significant brain damage.
It can have a big impact. It can have a
massive. This is a life-changing event.
Well, first off, how do you diagnose one?
Well, basically, you have people that present with this aneurysmal subarachnoid hemorrhage, but a lot of other ones are found incidentally, or if people are having symptoms such as headaches, not your generic headaches, but the worst headache of your life is kind of the event that typically triggers this. Not something you're going to miss.
Well, on the surface, it sounds kind of scary to hear that information, but what should people know about things they can do to make a difference in their lives? Yeah,
so risk factors are a big part of that, and a lot of it's stuff you would expect. Control your high blood pressure, be active, don't use illicit drugs or prescription drugs that raise your blood pressure without being followed by your physician. And so a big part of it is just doing the stuff that we know already to prevent that. And then we have so many imaging modalities. People are getting scans for all kinds of things. And if you find one, then coming to a center of excellence, a place like Hurley Neurological Center, where we can counsel you and give you advice and follow those if they're stable, and give you advice about treating them and the different ways to treat them if they need treatment.
Well, let's expand on that. How do you treat an aneurysm?
Traditionally, these were treated with open surgery. You do a craniotomy and then clip the aneurysm with a metal clip so that it would permanently occlude that weakening of the vessel. Nowadays, we have really advanced endovascular techniques. We go through the groin and the arteries, and you can use different types of stents or ways to treat them and divert the flow and let them heal up that way. So it really depends on the circumstances, the presentation, and how that works.
Interesting. So overall, what is the prognosis then for someone? I know it's case by case, but
yeah.
Is there a hope for recovery?
Yeah, so we obviously want to try to prevent them from rupturing. So if we find them, then we can give advice about treating them. But if for those that rupture, there's that 40% that die, that 2/3 that have major brain damage. The biggest prognostic indicator is how people are when they have the event. So you have this worst headache of your life, and if you're conscious, that's a really good sign. Some patients, the ones that end up dying are really, really sick, are comatose at the time. And so that's the big first prognostic part. And we also, have a lot of experience dealing with those patients, and that's really why you have centers of excellence, because they're very sick, but they can still have really good outcomes if they're treated correctly.
Yes, they'll be in good hands for sure. And then, bottom line, why is it so important just to stay in tune with your body and stay on top of your overall health?
Almost across the board in health, you want to find things early. And so the earlier you have symptoms, the more you get into your primary care physician and get referred, the better. Because if you wait till it's too late or till symptoms are pretty pronounced, it's usually much more difficult.
Listen, we appreciate the insight, Dr. Bowers. And again, I know folks are in good hands when they see you. So thank you for your time.
Thanks for having us. Always good to be here.